Hello dear viewers, welcome back to the channel. I'm Dr. Jitin, a practicing dentist in Kochi, Kerala. Today we are going to speak about a new and interesting topic, that is scaling. Scaling of your teeth and gums. So here we go. First of all, let me introduce you all to an ultrasonic scaler. An ultrasonic scaler uses ultrasonic vibrations to help remove plaque and tartar from your teeth. The vibrations loosens the deposits from your tooth surface, making it easier to remove. The device can also effectively remove stains from your teeth. Ultrasonic scaler has mainly four parts. What you see here is called the controller, which controls the speed of the device. Now, what you see here is called a handpiece. A handpiece can be attached with different tips. The different tips comes with the idea of cleaning in different areas of the mouth. There are sharper tips which is used to dislodge the calculus and to clean in between your teeth, whereas there are the flatter tips which helps to clean the stain. Now, along with showing you an actual scaling procedure, we'll like to answer a few of the doubts which normally patients ask us. One of the most common doubts which normally we get is, does it hurt? Yes, it does hurt a bit and it does bleed a bit. This is because of the vibrations which the device creates to remove the calculus and stains. For people, those who have really sensitive teeth, it is advised to use a hand scaler to avoid these discomforts. Now, and very common another doubt which we normally get is, does it damage your teeth? Well, a very important thing which you should always remember and communicate with your dentist before the start of the procedure is whether or not you have crowns and white colored fillings in your teeth. This helps your dentist to carefully maneuver those areas with caution and avoid damages to your crowns and fillings. Now, coming on to the major question, does it damage your teeth? Normally, no. Normally, nothing happens to your teeth other than a transient sensitivity or a temporary sensitivity, which occurs due to the vibrations. Because the ultrasonic scaler does not have the capacity to cut through a surface, but vibrate and dislodge a piece of calculus and stain. Now, coming on to one another very important doubt which normally patients ask us. Who all need a scaling? Well, most of us recommend getting a scaling done at least once in a year. Now, you might need a scaling procedure more than one time in a year if you have a gum problem, because if left untreated, gum diseases can lead to bone and tooth loss. People with stains are also recommended to have scalings more than once in a year. Now, one another doubt a patient normally asks us is, what are the things he or she should be careful after a scaling? See, avoid eating for a couple of hours. Eat soft diet and avoid heat and cold for a few hours after scaling. Use a mouthwash to rinse your mouth. Now, another doubt which normally we get is, why does it bleed so much during scaling? See, the answer to it is, the inflamed gums which happens due to the deposits around the tooth will bleed while doing a scaling procedure. That is very common. That is temporary and will stop within a few hours to a few days after scaling. Now, coming on to another question, who all can perform a scaling? A dentist as well as a trained hygienist can perform a scaling procedure. Now, what is the role of water in the scaling device? Well, it is to flush out the loosened deposits and to reduce heat created during the procedure. Now, why do I notice gaps in my teeth after scaling? Well, this is because of the thick calculus deposits which were present on your teeth is no more. So these areas appear vacant when you feel with your tongue. Now, does the scaling removes bad breath problem? Well, the answer to it is, if the bad breath problem is due to deposits on your gums and teeth, definitely it will. But if the bad breath problem is due to another reasons like gastrointestinal reasons, no, it won't. Will your tooth shake after scaling? See, the tooth which is already damaged due to a gum problem may appear to shake after the procedure, which is due to the pre-existing gum problem which the patient already has. And the only thing which was holding his or her tooth together was the calculus deposits. Once the calculus deposits were clean, the teeth will give you a shaky feeling. The shaky feeling will gradually improve over a period of time. Hope today's video was very informative to all of you. Thank you for your constant support. Please do support us with subscribe and likes. Thank you.